The ultimate success of any training program centers on its ability to induce specific physiological adaptations and translate those adaptations into increases in performance. Now, at the center of this process is the ability to manage the adaptive response, handle accumulated fatigue, and capitalize on the after effects established from the various training factors encountered. Now, the strength of a periodized training plan lies in its ability to sequence and structure the training interventions in order to manage all the factors and attain peak performance at appropriate time points. Now, one of the foundational concepts from which periodized theories have been developed is called the general adaptation syndrome. So anytime the body experiences a novel, new, or more intense stress than previously applied, for example, lifting a heavier training load or a greater volume load, then the initial response, also known as the alarm phase, occurs, which is an accumulation of fatigue, soreness, stiffness, or a reduction in energetic stores that results in a transient reduction in performance capacity. So after this initial response, after this initial decrease in performance that we see here, the body moves into the resistance phase, in which it adapts to the stimulus and returns to a normal functional capacity. So basically returning back to the baseline performance level. Now, if the training stress is appropriately structured and not excessive, these adaptive responses can result in specific biochemical, structural, and mechanical adjustments that further elevate the athlete's performance capacity, resulting in what is known as supercompensation. So supercompensation will be shown here by this new baseline performance, again higher than the original baseline performance, suggesting an improvement in performance has occurred as a result of an appropriately designed training program. If, however, the stress persists for an extended period of time, the athlete can move into what is known as the exhaustion or overtraining phase. This is indicated by phase 4 here on this figure. Now, from a training perspective, excessive loading, monotonous training, and overly varied training can all result in the occurrence of this phase. Additionally, the responses to training can be affected by other non-training stress, for example, work stress, insufficient sleep, relationship stress, or poor diet. And this other non-training stress can contribute to the overall stress level experienced by the athlete. So one of the goals of periodization of training is to avoid the occurrence of what is known as the overtraining syndrome, or OTS. An overtraining syndrome can result from a combination of excessive frequency, volume, or intensity of training that results in extreme fatigue, illness, or injury. And in many cases, this is accompanied by a lack of sufficient rest, recovery, and perhaps even inadequate nutrient intake. So when the body experiences a training overload, perhaps for a few days following that training bout, acute fatigue sets in. This is accompanied by stiffness, soreness perhaps. However, over time, in response to the training load, in response to the acute fatigue, a number of adaptations occur within the body that result in basically an improvement in performance. Now, if the training load is too much, let's say the stress of training is too high, the athlete may transition into what is known as functional overreaching, in which a decrease in performance may persist for days, maybe even a few weeks. However, this functional overreaching many times is a strategy that is used by athletes in order to overwork or overstress the body, to deliberately suppress performance and thus build up their tolerance. After this period of overwork, they would then undergo a taper period for several days, for example, with the goal being that there would be a supercompensation of performance that would occur as a result of that overwork and then appropriately taper period. Now, if the training stress would continue on without adequate recovery, the athlete may transition to non-functional overreaching, again characterized by a marked reduction in performance that may persist for weeks to months, again assuming that the stress continues on the athlete. And then eventually, if the stress is too much for the athlete to handle without adequate recovery, they may transition into the overtraining syndrome. So the overtraining syndrome is simply defined as prolonged maladaptation, not only of the athlete's athletic performance, but also of several biological, neurochemical, and hormonal regulation mechanisms. So if we look at performance here, for acute fatigue, functional overreaching, non-functional overreaching, and OTS, we see that all of these stages of overtraining are marked by a decrease in performance. However, when we're talking about acute fatigue, typically it's a very transient decrease in performance, or depending on the stress, it may be no effect. But the goal here with acute fatigue is to ensure that adequate recovery does occur between training bouts, with the overall goal to increase performance. With functional overreaching, typically see a temporary decrease that returns to baseline with appropriate recovery and rest. However, if the stress continues on the athlete without appropriate recovery or rest, they may eventually transition to overtraining syndrome, which is characterized by a marked decrease in athletic performance that may persist for many months or even years, actually ruining the athlete's career. In addition to this decrease in performance, we also may notice a decrease in muscular force production. We may notice metabolic changes such as decreased glycolytic capacity. There may be immune changes as well, including the increased susceptibility to sickness and infection, and also psychological changes, including emotional and sleep disturbances with OTS. So what are the markers of overtraining syndrome? Well, those are not well defined. So in many cases, we're evaluating or assessing are there performance decrements to verify that overtraining syndrome is evident. So it may also be important to look at a number of psychological effects, including a decreased desire to train, evaluating the athletes if they have a decreased joy from training. And many of these psychological effects are often observed before actual decrements in performance occur. So we can also look at an athlete's scores in various tests of athletic performance. And if those assessments are poor than on previous tests, we could also maybe assess that as a potential marker or measure of aerobic training. We also have to assess the athlete's training program, asking ourselves, are there any errors in the design of the athlete's training program? So common training mistakes that may lead to the occurrence of OTS include the chronic use of high intensity or high volume, or a combination of the two, or too rapid rate of progression over time. We also have to assess any confounding factors, such as a variety of psychological signs and symptoms, maybe perhaps social factors including family and relationship stress, or if they have recently traveled across multiple time zones, that also should be considered because that's an additional stress that's being placed upon the body. We also, it's common to exclude a variety of conditions and illnesses that are not OTS, but may appear to be OTS. So these include a number of confounding illnesses, if they have any muscle damage or endocrine disorders such as diabetes, if they have an eating disorder, or some musculoskeletal injury that may mimic some of the signs and or symptoms of OTS. Now it's important to note that no single marker can be taken as an indicator of OTS. So OTS has been shown in research is to be multifactorial in its nature. So that's recommended that regular monitoring of a combination of performance, physiological, biochemical, immunological, and psychological variables should be considered in terms of the diagnosis of OTS.